We know that we have a rapidly aging population, and if you can't look out 6 months, you certainly can't look out 2 years, 5 years to really anticipate what is the demand along the continuum of services, but particularly for our elderly. How do we structure a system where we're incentivizing services and supports for people in their home, or home-based care, private duty nurses, direct support staff, and then certainly assisted living and nursing facilities? So the last 4 years has been about how do we get our financial house in order, and then begin to look at where are the pressing priorities within the budget that we want to address. We had to come up with that money. It's over $26 million over 2 years that we proudly bring forward to prioritize increased funding, reimbursement rates within the Medicaid program for nursing facilities. So just to put that in perspective, the Medicaid program in the year roughly 2000 was about 180,000 people. When the governor took office, it was 354,000 people enrolled in the Medicaid program. And the cost of supporting those people also doubled. So about that same time, in the year 2000, it was $1.2 billion. Today, it's $2.5 billion. And over that period of time, that crisis-oriented management of the program meant that no one was sitting down and saying, all right, now let's look at the rate of reimbursement in nursing facilities. The governor recently around assisted living, and he was concerned that in our original biennial budget submission, we did not have a rate increase for assisted living. And so we are bringing that forward in it's referred to as a change package, but it's an amendment to the budget that we just submitted. So we are going to propose a rate increase in Medicaid for assisted living as well. Let me talk about one other area that has been troubling as well. So the state, the Department of Health and Human Services, has been in a mode for many, many years, well preceding this governor, of chasing federal dollars, chasing Medicaid dollars, to the point where if a program couldn't leverage a federal dollar, it lost favor in the overall mix of priorities. So one of the programs that we oversee is homemaker services, which I believe is an incredibly important program, that when you need to certain supports in your home, meal preparation, laundry, activities of daily living, I mean, those are some of the early challenges that we want to be able to support. Well, we have over 600 people on a waiting list for homemaker services because it's 100% funded with state dollars. It doesn't leverage a federal Medicaid match. It's not reimbursable under the Medicaid program. But it's critically important. And it can help someone stay at home longer and delay when they may need more expensive 24/7 assisted living or facility-based services. So the other part of our effort that isn't reflected in the budget but will be reflected in our internal operations is that we are identifying other resources, financial resources, to cover the costs of that homemaker program and to reduce that wait list. Similarly, home-based care, which is just another 100% Medicaid reimbursable, so for people with a different income level to support their needs. So we are looking at ways to provide additional resources and supports, just in the overall scheme of our priorities, so that we can look at